like to address this question in a two-part, and particularly to you, Michael, even though I have 100 questions for all of you, frankly, especially clinically, in the real world, practically. I'd like to hear your insight on this. Michael, you're obviously fighting a real good fight at a very advanced level. I was listening very closely to where you're going with Cook, and we're in it up to our ears as planner designers. I would like to hear your real theory on where you're going to move forward now, because it sounds like your Meditech interface with all your middleware worked, and it was fairly seamless with all your systems. That is a 10,000-pound gorilla, no doubt about it. The next story to that is, how do you project out on the real bandwidth of the future? Is 802.11n enough? Is 802.11n plus enough? Or are we going to be going out into white space and getting into higher capacity? Because the capacity data is just scary to look at. I would love to hear your projections on that. Thank you.
Great questions. Let me get my crystal ball out and shine it up a little bit. First, on your first question, I think was what is our immediate changes that we're going to make, or what are we doing right now with the systems we have? And right now we're augmenting the coverage and capacity of the facilities we have. Like I said, we are doing an EHR in the hospital with bedside medicine verification. We're actually doing that with an infrastructure that was probably built 8-9 years ago. We have bedside computers. They're on wheels, but I wouldn't call them mobile. They don't go from one room to another. I think because of that, and if there are nurses in here, we had a conversation earlier this morning about the nurses know where the dead spots are. They don't go there. So that's one advantage we have in our existing facility, but in the new facility, we are going to put in a converged antenna system, and we're going to do 802.11 layering, which should increase the capacity 2 or 3 times. We're going to leverage 802.11b, we're going to leverage 802.11n or A, 2.4 gigahertz and 5 gigahertz both. And as I said earlier, our goal is to define where those networks are going to talk so that we can get them their own lane to talk. Obviously, voice over IP is not tolerant of any kind of data, so we can't have that mixed in with an 8-year-old IV pump that wants to transmit its data every once in a while. There's just such a variance of devices in the field out there right now. As to future-proofing the solution, well, we know what we know right now. We know what's in the spectrum of wireless that's available for use today, and it doesn't mean it's not going to change tomorrow. More channels are becoming available, but the antenna systems can be somewhat continuous, and the signals can live with each other on the same antenna system. So there's a span of signal, and I have a picture here. It goes anywhere from about 400 megahertz to about 6 gigahertz. We know the 4G is going to be at 2.7 gigahertz. It's just a matter of time until somebody fills something in all those gaps. But there is some technology here today that I think can help us with that. I can't guarantee it's going to be future-proof, but I think we can support what's here today and what's in the foreseeable future with technology that exists.
I don't have a crystal ball, and what I like to contribute to what Michael said, I agree with you, your projection, is that basically I see tremendous increase in personal tools. That meaning that identification, RFIDs, individual device messaging, all will be increasing demand on the communication channels. So if you're looking at spectrum, the demand for spectrum is going to be increasing significantly, and the distributed antenna approach probably will be a more convincing solution to take. The thing that we didn't mention much about is the video. We mentioned voice several times, but you just take one cath lab exam, one sonography examination to put on the network, and suddenly you see the load we're talking about. when those images start floating. And that's where I'm seeing a significant increase in demand for spectrum. So anybody who is in the business of putting those type of network together must accommodate significant exponential growth of demand for speed and access to communication. That's definitely going to be my projection. With that, with the personal tool, I see tremendous increase in security tools. So you will need to have additional channels that are just dealing with encryptions, with verification, with if the dear doctor is really the dear doctor, and make sure that he is not getting too upset that we ask so many questions. Technically, is that your fingerprint, is that your face, is that your ID tag, and make sure it's much more smoothly going. So additional increase I see is in identification for security purposes and need for bandwidth.
Just as a quick tag on to the streaming video, as you're looking at your network, that's one component. Remember that if you're looking at video from endoscopy in the OR and you want someone to be off-site reviewing the procedure as it's happening, it's not just your network that you need to consider. There are other infrastructure elements like Citrix and the backbone that you're going to use to deliver that. So as you're looking at all the building blocks, make sure you understand each piece and that you pull those silos in.
Amen.